Good day. I'm Chauntelle Bagwandeen, and together with Vino Dorsamy, we're presenting a paper on the effect of formula scoring on student performance and behavior in multiple choice summative assessments. So, assessment is vital to determine students' progress and ultimately certification. However, poor quality assessments impact significantly on the type of graduate produced in terms of their functioning in their profession, ethical reasoning, and contribution to lifelong learning. Multiple choice questions are widely used in assessing students in all fields of study, including medical education. Formula scoring is a means designed to reduce the risk of obtaining a correct answer through guesswork. And one method employed universally is negative marking of an incorrect choice. Hence, removal of negative marking potentially enhances risk-taking behavior, that is, guessing the correct option by students, since no penalty is applied for incorrect answers. Innovative changes in the way we teach and assess is integral, but should be evidence-based. And removal of negative marking without addressing the evidence for and against this may further compromise assessment integrity, which has already been compounded by the transition to online learning, teaching and assessment necessitated by the current pandemic, especially in the absence of robust monitoring of tests and examinations. Specific core competencies have been identified for medical graduates, namely advocacy, professionalism, lifelong learning, and ethical behavior. So any means of assessment that distracts from these core competencies can therefore be considered to be of inferior quality, failing both students as well as the populations they are training to serve, despite adequate pass marks. Students need to be capacitated to bridge social and cultural divides that impact on literacy and technological skills. And key is also promoting academic integrity. Assessments therefore need to take these requirements into consideration without simply being used as a means of increasing throughput. At the University of KwaZulu-Natal, the chosen format of assessment previously for both pre- and clinical years in their written tests and examinations has been a best of 4 option MCQs, in which a penalty of minus 0.33% was imposed for incorrect answers and no marks awarded or deducted for omitted answers. However, a decision was taken in 2019 to remove negative marking, which was neither piloted nor previously validated. And this action can presuppose the fact that both reliability and validity of an assessment can be lowered, while increasing the total score of the student through increased guesswork without consequence. So the literature notes that MCQs are advantageous because they test higher levels of cognition and critical thinking. They are quick, easy, and cheap to administer and mark, and can be used to test across multiple domains and a wide range of knowledge. However, MCQs are not easy to construct without appropriate training, peer evaluation and review, and the stems need to be worded so as to prevent queuing, and distractors must be plausible. MCQs should also be subject to a consensual faculty-wide process of standard setting, and they should be designed to determine how adequate the student's knowledge is while discouraging guesswork. Our study set out to examine the effect of removal of negative marking. A cohort of students was given a formative assessment and divided into 2 groups. One was told there would be no negative marking, while the other was told that there would be. The subject material was relatively new to the students because they would cover this work later on in the year. This is important because we would then take the process further to compare marks of a previous cohort as well as this cohort when they would be exposed to the work during the course of the year to see then the scores obtained. When comparing the medians of, or the means of the groups, the group that was told that they would have no negative marking achieved a statistically significant higher score than those that were told there would be. The implication here is that students were more inclined to guess, given that there would be a 25% chance that they could guess the correct answer, and that this was further enhanced by the clues that were given by the stems and distractors. So, what does this mean? Anecdotal evidence from discipline and departmental reviews of end-of-term tests and examinations seem to indicate that students year on year perform better when negative marking of MCQs was removed. However, very little empirical evidence from our university exists to objectively assess our assessment methods. And this has further been exacerbated by the transition to online assessments. This lack of student integrity and the propensity to perhaps cheat is not unique to South Africa. It's been reported that roughly 1 in 10 American and Canadian students themselves might be prone to cheating. Even more importantly, how do we determine what is a passing score? Can we look at a pass mark of 50% and extrapolate this to mean that the student is competent? Rather, we should look at standard setting as described in the Cohen method, which is a valuable means of assessing the attainment of the desired level of competence. So we could consider the pass mark to be 65% of the score of the top 95th percentile performing candidates, rather than an arbitrary pass mark. Further, we need to diminish guesswork by students attempting MCQs by appropriately constructing them so that they have relevant stems and plausible distractors. As our results seem to indicate, students were able to work out what could possibly be an answer, even though they had no prior association with the work that they were being tested on. Training of examiners and peer review of MCQs are consistently stressed in the literature. Within our setting, often these are poorly designed and add to the propensity for students to guess. So our personal experience and conversation with colleagues at assessment meetings have highlighted these deficits in our knowledge base and prompted the need for further research in this area. Assessments should not be considered punitive. So, going forward, implications for practice mean that we should use our assessments as a guide to determine gaps in students' knowledge and implement appropriate learning and guiding interventions. Determining areas of weakness based on test scores that are a more accurate reflection of a student's knowledge when safe, that is, no penalty is applied, will enable us to do this. Ideally, the recommendation that will emanate from these findings would be for the process to be iterative. The student continues to take the assessment, having engaged with the deficient area of knowledge, and with the relevant interventions being implemented by the lecturers until the subject is mastered. In this way, emphasis is placed on achieving the desired competency rather than passing a test, and is more likely to result in an empowered and capacitated health professional that can positively impact on the health status of the population. So in conclusion, we believe that by providing objective evidence on the impact of removal of negative marking on testing methods that are already flawed in design and construction, we can then work towards strengthening our overall skills and competencies in designing our tests and examinations. This process must be accompanied by capacitation of examiners in the construction of MCQs, and the tests themselves must be constantly reviewed instead of merely reusing questions. And finally, we advocate alternative methods of standing setting rather than just implementation of an arbitrary pass mark. We thank you and look forward to your comments and questions.